Hi, I'm Dr. Suraj Chirania, hematologist and BMT physician practicing in Mumbai. Welcome to our channel. Today we will discuss how multiple myeloma is diagnosed, outlining the diagnostic test and criteria. Multiple myeloma is a blood cancer, is a cancer of blood. It usually damages the bone and kidney. Diagnosis of multiple myeloma sometimes is very challenging, so you requires expert opinion. So these are the few things we need to know before diagnosing multiple myeloma. The tests usually we do to carry out the diagnosis are: first blood test, second urine test, third imaging, fourth are genetic test through the bone marrow aspiration and biopsy. So understanding the first part, blood test, usually the routine blood tests what we do are CBC that may shows anemia, liver function test that shows low albumin and high proteins, renal function test that shows high calcium and increased creatinine. Second, in blood, there are other set of blood tests that are done by the specialist doctors. So these tests are serum protein electrophoresis, serum immunofixation, serum free light chain assay, and immunofixation studies. Second, urine test. In urine test, usually we see 24-hour urine protein, Bain-Jones protein, urine protein electrophoresis, and urine free light chain assay and immunofixation test. Third, imaging. In imaging, there are X-rays for obvious things as a screening. X-ray we will do. If X-ray is not showing the early features of myeloma, we can do a whole body CT scan or PET CT scan. If any lytic lesions are present on this imaging or any soft tissue density along with lytic lesion, that can point towards the presence of multiple myeloma. Fourth is genetic test. These genetic tests are mostly what we do are karyotyping, conventional karyotyping and FISH testing. These tests usually we do on a bone marrow test. So bone marrow test is just like a blood test where we take a blood sample from your hip bones after giving the local anesthesia. This bone marrow we check for aspiration for presence of abnormal plasma cells, biopsy see for sheet of plasma cells presence or not, and in this aspirate sample we proceed for genetic tests like karyotyping and fish test is very essential at the time of diagnosis because it will tell us how aggressive is our myeloma and how good it will respond to our treatment. Usually multiple myeloma we divide into standard, intermediate and high risk category. These all risk categories are depend on the cytogenetic and fish testing. That's all to understand how we diagnose multiple myeloma, and we need to do all this blood, urine, imaging and genetic test. Thank you. Till next, stay healthy, stay informed.